Amputation is an unfortunate and ugly subject, but one we all need to understand and know how to avoid. Our own Dr. David Marks is joined by a special guest.
Thank you, Nicole. And I'm here today with Dr. Mark Hinkes, who runs the Amputation Prevention Unit at the Veterans Affairs Hospital in Nashville, Tennessee. He's also the author of the 2009 book, Keep the Legs You Stand On. Now, amputations from diabetes are a worldwide crisis. One patient loses a leg in the U.S. every 7 minutes, but the CDC says that many of these amputations are preventable. So, Dr. Hinkes, blood sugar monitoring and regulation is very important for diabetes, but how does it prevent amputations?
Well, chronically elevated blood sugars cause vascular and neurological disease in the patient with diabetes. Additionally, their immune system is affected. So while the blood sugars are elevated, this causes neuropathy in the feet, where the patients lose protective sensation. And if they have some type of trauma, a cut, they will have bad circulation and have a tougher time healing that.
Let's say a person has a stone in their shoe. What is actually happening to cause the damage that is eventually catastrophic?
Mechanical trauma is unfelt in the patient with neuropathy. I've had patients who walked all day with a piece of corn in their shoe or a stone in their shoe, and they felt nothing, and they knew they didn't have a problem until they actually took their shoe and sock off and saw that they had a hole in their foot.
Is there a way to test for this type of neuropathy?
I brought a tool with me. I'll give you one, and I'll use one. This is called the monofilament testing device. And this is the worldwide gold standard that we have for testing a patient to determine if they have loss of protective sensation on the bottom of their foot. We test under 3 or 4 different places on the bottom of the foot, and the patient will either tell us, yes, I felt it, or there will be no response because they did not feel it. Once we can identify those patients who have lost protective sensation, we have a wonderful, wonderful opportunity to provide them with preventive care, whether that be shoes, insoles, braces, medications, therapy.
What is the progression from that initial trauma to the actual problem that causes the amputation?
Once we get an opening in the skin, bacteria, fungus, mold, yeast, viruses can enter through that portal of entry and start an infection. And because diabetic patients with neuropathy don't feel, they've lost their protective sensation. I like to call pain the body's burglar alarm. And when their burglar alarm isn't functioning, they don't feel it. And many, many diabetic patients develop an attitude of saying, well, since it doesn't hurt me, it must not be a bad problem.
And what happens to them?
Well, the wounds will become infected. If we must amputate, we try to leave the limb in a viable condition so that the patient will be able to walk and have as normal of a life as possible.
Thank you, Dr. Hinkes. It was a very informative discussion.
Thank you.